Hey guys, welcome back for our daily practice questions. This week's practice questions you'll see in the gold mustard color. Some of you have reached out as y'all are working through it, but if you go and look at my channel, one, I have things categorized in a playlist, but our daily practice questions each week, the title page is the same color, okay? So once you get through seven of those in a certain color, it'll flip. You'll know that you're on to the next week. But anyways, I like to get into my intro and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I started doing this back in 2015, assisting nurses and nurse practitioners internationally after I needed assistance. And I told myself, once I got through, I was going to provide the things and the tools so that other people didn't have to wonder what to expect or wonder how to prepare or wonder what to do after being unsuccessful, how to get back on track, how to restructure your studies. So, all these things are designed for those purposes in hopes of helping the next person, okay? Now, I always get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis. But the questions that I have here, I have designed and created based on the current guidelines that are being tested on the ANCC and AAMP at this time. Now, if I'm doing videos and I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Now, these questions for today, I've had a few non-clinical questions from people or asking how to prepare, and I do offer a non-clinical review course, and all of my courses and books and things include a non-clinical portion, which is those professional style topics that are on both exams, but it is heavily saturated on the ANCC. It's over 60% of the exam. So I wanted to throw in some of the non-clinical. You'll see I do that periodically, and I just tossed it in so that y'all can make sure you're staying on top of this as well, okay? So question number one states, all of the following are examples of secondary prevention except, is it A, cervical cytology, B, COVID testing before starting a job, C, mammograms, or D, wearing a mask? Take a moment and tell me what you got in the comments. All right, so I always recommend reading the stem of the question first because it slows you down and allows you to make sure that you're answering what is truly being asked. Now, here, the stem of the question is the actual question. So it says, all of the following are examples of secondary prevention, except. Reading that stem is I say this because of this practice. When you see words like accept, you can commonly miss over it if you're not paying attention to what the stem is actually asking you, right? So accept, we're looking for the incorrect answer, right? So we need to think of what is secondary prevention. So secondary prevention, think of your primary, secondary, tertiary, right? Secondary prevention is screening. I always say, my Brittany's brilliance, think P for primary, P for preventative actions, S for secondary, S for screenings, T for tertiary, T for treatment, okay? And I'll explain. So here we're looking for secondary prevention. So those will be screening tools, exams, things of that nature, right? So cervical cytology is a screening. COVID testing before starting a job, a screening. Mammograms, a screening. Wearing a mask, that's primary, right? Because that is a preventative measure. So D is your answer because that's the only one that's not a secondary prevention. So let's use COVID for example, so I can kind of give you a full picture. Primary prevention, I said P, think preventative, right? For primary is like wearing the mask, right? We're wearing the mask to prevent spreading COVID and potentially getting COVID, right? Then secondary for COVID could be screening before the jobs, or how they used to do, like they'll scan us to check our temperature before we came in and things of that nature, doing these screenings to see if you have certain things. And if you have COVID, then they will provide the medication, the treatment, and whatever was deemed appropriate for that particular person. And that's tertiary treatment, right? T for tertiary, T for treatment. Primary is the preventative, secondary is the screening, tertiary is the treatment. All right. Question number 2. The nurse practitioner and NP student are discussing leadership styles. The NP student inquires which leadership style is the one that lacks structure, the style that lacks direction or control. What is the best response by the nurse practitioner? Is it A, democratic, B, authoritarian, C, laissez faire, or D, advocacy? Take a moment and tell me what you got in the comments, you guys. All right, so stemming the question states, what is the best response by the nurse practitioner? So what are we responding to? The nurse practitioner and NP student are discussing leadership styles. And the NP student inquires about the leadership style that lacks structure, that style that lacks direction or control. So, with non-clinical questions, it is knowledge-based. So when I say this, you say that type thing, right? So the answer here is C, laissez-faire. And I always say, Brittany's brilliance, laissez-faire sounds real lax, real lax, right? They're so lax that there's no style, there's no structure, there's no control. You're just flowing and see what happens type of leadership. That's laissez-faire. Democratic is the more team approach. We're cooperating and working as a team. Authoritarian is exactly what it says. It's where the authority is in control. It's that approach, almost like example is like a military style thing. Leadership, the authority is who you listen to, and that's that, right? And then advocacy, to advocate for a patient that has nothing to do with leadership styles. So authoritarian, democratic, laissez-faire. All right. And then lastly, question number 3 for today. A patient presents to the office today for follow-up. After the visit is complete, the patient inquires on what Medicare plan that he should have to cover a wheelchair. What is the best response by the nurse practitioner? Is it A, Medicare Part A, B, Medicare Part B, C, Medicare Part C, or D, Medicare Part D? Take a moment and tell me what you got in the comments. All right, so stemming the question here states, what is the best response by the nurse practitioner? So what are we responding to? This patient is inquiring about which Medicare plan would cover the need for a wheelchair, right? So Medicare Part A, I say that's the automatic plan. That's the one you get automatically if you meet criteria, being 65 years of age, having end-stage renal disease, or being diagnosed and deemed disabled. That's your baseline thing. Medicare Part B is that basic coverage for the things like outpatient, your DME equipment. So you would go with B for the best answer here because that would cover your DME, your wheelchairs, right? C, is the choice plan that covers vision and dental. And then D is the prescription cover, D for drugs, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Make sure you're subscribing if you're looking to get notifications for when I post these daily. And, as always, make sure you meet me back here. If you need any of the things that I offer, feel free to call the Nursing Studio at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1 at gmail.com. Now, the things that I offer is a review book, and there's videos in my shorts that you can see what the book is like. Also, if you go to any of the links, you'll be able to preview it, especially on the Amazon link. It is offered in an ebook fashion so that you have access on any device as soon as you purchase, and then the paperback option will be shipped to you. Both are linked in the bio of this channel. My self-paced review course designed for family and adult Gero nurse practitioners, testing on both exams, AANP and ANCC exams. That's also linked in the bio of this channel. It's broken down by systems. There's videos, there's mini quizzes, and you can watch it as many times as you would like. And then our one-on-one sessions. Like I said, my non-clinical, I have a non-clinical review as well. One-on-one sessions, I always say reach out either by phone, email, text message, so that we can gauge what you truly need. because with the one-on-one session they're customized, but there's three different options you can go with. You can do, if you're just looking to get a session for weaknesses that you want to work on, if you are looking for an exam readiness assessment, that's an option. Or lastly, if you want a custom plan, say you've been unsuccessful and you just don't know which direction to go in and would like me to assist you with gauging where you are, coming up with a study plan, working alongside with you to get you from unsuccessful to successful, that's that custom package. So you can give us a call or shoot us an email and let's see what you need. But as always, make sure you meet me back here. Happy studying. Bye, y'all.